to wrest from nature the secrets which have perplexed philosophers in all ages, to track to their sources the causes of disease, to correlate the vast stores of knowledge, that they may be quickly available for the prevention and cure of disease. These are our ambitions. That quote, wow, it really captures the spirit of a deep dive like this, doesn't it?
It really does. It's about getting to the absolute core of understanding health and, crucially, how we can actively prevent illness based on solid evidence.
Yeah, exactly. And that's our focus today, really digging into the proactive side of things, maintaining health, preventing illness before it even starts.
We'll be drawing on insights from, the medical literature itself, looking at the role physicians play, but also the nitty-gritty strategies for actually promoting good health.
And the goal here for you listening isn't just about dodging sickness. It's about giving you that foundational knowledge, the top pros in medicine use.
Right, so you can potentially extend those healthy years, your health span, improve your quality of life day to day.
And make really informed choices about your own well-being, all based on the best science we have available. It's like getting that insider's edge.
Exactly. We're going to unpack the core principles, the most effective approaches to staying healthy, all grounded in solid evidence.
Okay, let's get into that. Part 1, the foundations. Starting with the bedrock of medical practice and prevention. It's kind of fascinating. The word doctor itself.
From the Latin docere, meaning to teach.
Right, and that really highlights something fundamental about what doctors do.
It's so much more than just diagnosis and treatment, isn't it? At its heart, it's about sharing knowledge.
Between colleagues, with medical students.
And critically, with patients. It's a core function.
And medicine advances through this constant cycle, right? Research, observation, analysis, interpretation.
It's a continuous loop. Discovery, seeing how it plays out in the clinic, making sense of it all, and then refining our understanding. It never really stops.
Which makes research absolutely vital for moving things forward.
Indispensable. But that knowledge only becomes powerful when it's shared and applied effectively. That's where the teaching role is so central, translating research into better patient care.
Now, here's an interesting layer. Physicians have this ethical responsibility too, right?
Yeah.
The source mentions encouraging patients to participate in properly approved clinical research.
Yes, but this comes with a huge ethical caveat. Patient participation is vital for progress, no doubt.
Right.
But the patient's well-being, their rights, their safety, that has to come first. Always. No exceptions.
So physicians need to be really aware of potential conflicts of interest, like between research goals and patient care.
Absolutely aware. The patient's best interest is the absolute priority, overriding any research objective. It's a non-negotiable line.
Okay. So, shifting gears slightly, let's talk about the goals of all this. Prevention comes up as a key theme.
It's described as, a hallmark of excellent medical practice, even a measure of how well a whole healthcare system is functioning.
And the main goal isn't just adding years to life, is it?
Not primarily. It's about preserving the quality of those years, extending our health span, the time we spend healthy and active.
Which leads to this concept called compression of morbidity. I like that phrase.
Me too. It paints a clear picture. The idea is to squeeze that period of sickness and decline into the shortest possible time right at the end of life.
Instead of long, slow decline, the source mentions a squared curve to illustrate this.
Exactly. Imagine a graph of health over time. Normative aging often shows a gradual downward slope.
A slow slide.
Right. The goal of prevention is to keep that line high for as long as possible, then have a steeper drop near the end, squaring it off. More years of vibrant living.
So practically, how do we achieve this? The source breaks prevention into 4 types. Tertiary first. Sounds intense.
It is. Tertiary prevention is about rapid action when someone is already critically ill, preventing imminent death or severe disability.
Like the example given, intervening during a major heart attack.
Precisely. Like performing a percutaneous coronary intervention, opening a blocked artery to save heart muscle during an ST segment elevation MI. It's emergency intervention.
Okay. Then secondary prevention. Is that for people who've already had an issue?
Spot on. It's about preventing recurrence, stopping the disease from coming back, or preventing death in someone who's already been diagnosed and treated.
Like using tamoxifen after breast cancer treatment.
Exactly. For certain types of breast cancer, tamoxifen helps reduce the risk of it returning. That's classic secondary prevention.
Makes sense. So primary prevention must be about stopping it the first time around.
That's it. Reducing the risk of the disease happening at all in people who have known risk factors.
Like treating high blood pressure before someone has a heart attack or stroke.
Perfect example. You manage the risk factor, the high blood pressure, to prevent the disease event itself.
Okay, and the last one, primordial prevention. Sounds even earlier.
It is. It's about going upstream, preventing the risk factors from developing in the first place.
So not just treating high blood pressure, but stopping people from developing it.
Exactly. It focuses on things like community-wide eating patterns, physical activity levels, social determinants of health, the big picture factors.
This seems like the ultimate goal, then, for reducing chronic disease overall.
Many experts believe so. Because, as the source points out, once a risk factor develops, it's really hard to get back to the risk level of someone who never had it.
So even if you treat hypertension well,
The underlying risk might still be slightly higher than someone who always maintained optimal blood pressure. There can be subtle, irreversible changes. That really highlights why preventing the risk factors themselves, the primordial prevention, is so potentially powerful.
okay, so we understand the what of prevention, but the how, getting people engaged, that seems like the tricky part.
It definitely is. The source notes that even with secondary prevention, like taking medications after a heart attack, adherence can be surprisingly low, even in good systems.
And for primary prevention, just telling someone their risk percentage often isn't enough motivation.
Often, no. It takes more than just numbers. We need a much more patient-centered approach.
Meaning you have to understand the individual, their understanding of the risk, how much risk they tolerate.
Their readiness to change their lifestyle or take medication consistently, and, crucially, their own preferences and values. It's complex.
So the clinician's role is about informing, but also about dialogue. Discussing the risks, but also the benefits and potential downsides of different choices.
Precisely. And it often takes multiple conversations, not just a quick chat, building that understanding and trust over time.
It sounds like a partnership. The source mentions motivational interviewing.
Yes, as a really effective technique, it's about working with the patient, finding out where they feel ready to make changes, and starting there, focusing on their goals.
That makes a lot of sense. Start where the motivation is.
And if someone has multiple risk factors, say high blood pressure and high cholesterol, maybe focus first on the one that poses the most immediate threat for an acute event, like getting blood pressure under control quickly. Or emphasizing smoking cessation because the risk reduction there is so rapid and significant.
Right. Okay, let's talk about prevention across the lifespan. This naturally brings up the annual physical. It's such a common expectation.
It really is ingrained in our culture, isn't it? But the evidence, it's pretty nuanced.
How so?
Systematic reviews haven't actually found a significant benefit in terms of total mortality for routine annual checkups in healthy adults without specific risks.
Oh, no impact on living longer overall.
The evidence doesn't strongly support that claim for the general asymptomatic population, and the data on specific causes like cancer or cardiovascular mortality is mixed. No clear overall benefit, maybe even potential for harm, depending on how it's done.
Harm, like overtesting.
Potentially. Or false positives causing worry. And looking at non-fatal events or general sickness, again, no large effects have been demonstrated.
Wow, that's quite counterintuitive for many people.
Mm-hmm.
But are there any positives?
Well, yes. These periodic visits do seem linked to higher rates of diagnosing things like hypertension and high cholesterol.
Okay, so finding existing conditions.
And maybe slightly better delivery of other recommended preventive services, like certain cancer screenings or cholesterol checks.
So not entirely without value, but perhaps not in the way people often think.
Exactly. The source suggests that given the lack of clear harm and some potential benefits for delivering specific services, periodic evaluations are probably reasonable for average risk folks.
But the key takeaway isn't necessarily the comprehensive head-to-toe annual physical for everyone.
Right. That traditional model in asymptomatic adults likely has a very low yield. The time might be better spent focusing on evidence-based components.
Regard.
Things like age-appropriate screening tests that are proven effective, preventive interventions like immunizations or specific medications for high-risk people, and really importantly, effective preventative counseling on lifestyle.
And the source points to the U.S. Preventive Services Task Force, the USPSTF, as a key resource here.
Absolutely. Their guide to clinical preventative services is invaluable. It highlights recommendations with at least moderate net clinical benefit, meaning the science shows the benefits outweigh the potential harms. It's the go-to guide for evidence-based prevention.
Okay, that's a great resource to know about. Let's move into part 2 then. Promoting good health through lifestyle and behavior. This feels like where individuals have a lot of agency.
Huge agency, though the source acknowledges clinicians sometimes feel uncertain giving advice here because the evidence can be complex. Studies vary.
But despite that complexity, the impact is massive, right? Over 75% of premature preventable deaths and disability linked to adverse behaviors.
It's a staggering statistic. It really tells you where the biggest opportunities for improving health lie.
And we're not doing great, are we? The source mentions low rates of Americans meeting heart-healthy eating patterns.
Very low, according to the NHA-NE's data cited. It highlights a major gap.
So effectively assessing, documenting, and helping patients improve these behaviors could have a massive impact on longevity, health, quality of life.
Potentially enormous. And interestingly, just the act of asking about these behaviors can sometimes nudge people in the right direction.
So getting comfortable with lifestyle assessment and counseling is crucial for clinicians. Let's start with healthy eating. So much confusion out there.
There is. But the source makes a great point. Despite all the noise and fad diets, there's actually remarkable scientific agreement on the basics of a healthy eating pattern for most people.
Okay, what are those basics?
Lots of whole fruits and vegetables, whole grains instead of refined ones, lean protein sources, healthy fats like those in olive oil or nuts, and non-fat or low-fat dairy.
And limiting.
Limiting frequent intake of foods high in refined sugars and starches, saturated in trans fats and sodium. Pretty consistent advice across the board.
The rule of thumb is helpful. Prioritize home-cooked meals from whole foods, heavy on the fruits and veggies.
That naturally minimizes a lot of the processed stuff, the hidden sugars, fats, and salt.
And when eating out,
Be mindful. Focus on those same whole foods, fruits, veggies, lean protein, whole grains. Go easy on sauces and dressings, which can pack a hidden caloric punch.
and a big one, minimize sugary drinks and nutrient-poor snacks.
Huge. Opt for water, unsweetened beverages. And for snacks, nuts, seeds, more fruits, more vegetables, simple swaps can make a big difference.
Of course, some people need specific diets for medical reasons like diabetes or allergies.
Absolutely. Tailoring is needed then. But for most people, the focus should be on whole foods, overall eating patterns, and calorie balance, not getting lost in specific micronutrients.
And we need to remember the nutrition labels can be confusing for many people.
Definitely. Clear, simple advice is key, which is why the official dietary guidelines for Americans are helpful.
Published by USDA and HHS.
Right. The 2020-2025 guidelines emphasize healthy eating patterns across the lifespan to prevent chronic diseases, obesity, diabetes, cancer, heart disease.
Based on nutrient-dense whole foods and appropriate calorie intake for a healthy weight.
And they use that healthy plate, visual, half the plate fruits and veggies, the rest split between whole grains and lean protein. It's a simple guide.
They also mention healthier oils for cooking, limiting added sugars, saturated fat, sodium, and moderating alcohol.
And they offer flexibility with patterns like the healthy U.S. style, like DASH, Mediterranean style, and vegetarian style. Adaptable options.
And generally, the core recommendations apply from age 1 onwards, just varying the amounts based on age, sex, activity level.
Correct. Calorie needs differ, but the principles are similar.
And again, success comes down to partnership, motivational interviewing, shared goals.
Just like any behavior change, it has to resonate with the patient and feel achievable for them.
Okay, let's switch to physical activity. The starting message is really encouraging. Any activity is better than none.
That's such an important message. And the rule of thumb, if you do nothing, do something. If you do something, do more.
Because the biggest jump in benefits happens when you go from sedentary to just low levels of moderate activity.
Exactly. That's where you see the steepest improvement on the health curve. More activity generally brings more benefits, but the marginal gains diminish.
The standard recommendation for adults is 150 minutes moderate or 75 minutes vigorous aerobic activity per week.
Spread throughout the week, in bouts of at least 5 minutes, plus muscle strengthening activities at least twice a week.
And doing more than that is even better.
Definitely. And critically, we need to address sedentary time, too. Even if you exercise, sitting all day has independent risks.
So just getting up, stretching, breaking up sitting time is important.
Modest efforts help. Variety in aerobic activity is also good, prevents boredom and overuse injuries.
For strength training, the advice is higher reps, comfortable weight, not max lifts.
Generally safer for reducing injury risk. Aim for maybe 3 sets of 15-20 reps, feeling the muscle work but not straining excessively.
What about the fear some people have about sudden cardiac death during exercise?
The risk does increase slightly during exertion, but regular training massively reduces that baseline risk. Gradual progression is key.
Aiming for maybe 30 minutes, moderate activity 5 times a week, then maybe adding intervals later.
That's a good progression. Intervals can boost fitness further once a baseline is established.
And extreme stuff like marathons or triathlons.
Need proper, graded training. They put significant stress on the body musculoskeletal. Even the heart muscle can show temporary damage markers like troponin.
So it requires careful consideration of overall health, training capacity, injury risk.
Absolutely. Now, like diet, there are specific physical activity guidelines for different ages.
Right, from HHS preschoolers,
Active throughout the day, lots of active play encouraged by caregivers.
kids and teens, 6-17.
At least 60 minutes moderate to vigorous activity daily, mostly aerobic, some vigorous, plus muscle and bone strengthening 3 days a week each.
Adults, 18-64.
Move more, sit less. 150-300 min moderate or 75-150 minutes vigorous aerobic weekly spread out. Plus muscle strengthening 2 days, more is better.
And older adults, 65 plus.
Follow adult guidelines if possible, or be as active as abilities allow. Big focus on balance, plus aerobic and strength. Adjust effort based on fitness, consider chronic conditions.
The guidelines also define moderate, vigorous, muscle strengthening, bone strengthening activities with examples, which is helpful.
Very helpful for translating the advice into action.
Okay, on to sleep, another fundamental pillar. Optimal seems to be 7 to 9 hours for adults.
That appears to be the sweet spot, yes. Less than 7 hours is consistently linked to a whole host of problems.
Obesity, diabetes, high blood pressure, heart disease, depression, mortality risk, impaired immunity, pain sensitivity, cognitive issues.
Wow, it's a long list. Sleep isn't passive, it's critical for repair and regulation.
And getting enough sleep has positives. Better weight loss success, blood pressure control, mental health.
Definitely. The benefits are clear. More than 9 hours. The effects are less certain for most adults, though may be okay for kids or recovery.
People worry about sleep quantity and quality, especially as they age. A sleep log can help figure things out.
It's a good first step for understanding patterns if someone's struggling with insomnia.
And basic sleep hygiene tips. Daily activity, avoid eating alcohol late, regular sleep schedule.
Those are key. Consistency is huge, and the source strongly advises against regular use of sedative meds.
Because of dependence, addiction, and altered sleep quality.
Exactly. They might induce sleep, but it's often not the same restorative quality.
Now, actual sleep disorders like obstructive sleep apnea, OSA, prevalence seems uncertain but potentially high.
Estimates vary widely, maybe 9% to 38% of adults, higher in men and older folks. It's likely underdiagnosed.
So screening is advised for people with symptoms like poor sleep, daytime sleepiness, or witnessed apnea.
Yes, using tools like the Epworth scale or stop-bang questionnaire before jumping to a formal sleep study.
Although the USPSTF finds insufficient evidence for routine screening in asymptomatic adults in primary care.
Correct, mainly due to lack of validation in that setting. But given how common and impactful OSA is, clinicians need to be alert, especially in obese patients with sleepiness or witnessed apnea.
And other things like restless leg syndrome can often be picked up from the history.
Often, yes. A few simple questions can point towards it.
Okay, weight management, a huge challenge, described as an epidemic in the US and elsewhere.
It is. Prevalence has soared since the 80s, hitting lower socioeconomic and minority groups disproportionately hard.
And the health consequences are serious diabetes, cancer, heart disease, joint problems.
A major driver of chronic illness. We also need to be mindful of eating disorders like anorexia and bulimia, especially with rapid weight shifts or underweight status in younger women.
Achieving and sustaining weight loss is notoriously difficult. Early dietitian referral helps.
Significantly. Personalized support is key. An initial goal might just be stopping further weight gain, weight stabilization. That alone reduces risk progression.
For actual weight loss, there's no magic bullet. Experimentation and tracking are important.
Very much so. Food logs, activity logs, apps can help identify what works. Structured approaches like intermittent fasting or commercial programs are options for some.
But the core principle remains negative calorie balance, burn more than you consume.
Fundamentally, yes. Reduced intake, increased activity. Patients need to find what works for them.
And studies show it's mostly about total calorie reduction, less about the exact macro ratios.
That's what well-controlled feeding studies suggest. Helping patients find a sustainable, calorie-reduced plan they can stick to is key.
And increased activity is crucial for keeping the weight off long term.
Often essential for maintenance, yes.
Right. Next up, tobacco cessation. A massive challenge due to nicotine addiction.
A huge one. Nicotine's effects are powerful and long-lasting. Assessing past attempts and current readiness to quit is step one.
Follow-up, reinforcement, nicotine replacement, meds, all important.
Very important tools to increase success rates. And acknowledging that relapse is common, encouraging people to try again.
What about e-cigarettes? This source seems cautious.
Very. Some limited evidence for adult cessation, maybe. But a major public health threat for youth due to high nicotine, unknown long-term effects on developing bodies.
And vaping other things? Often flavored.
Big danger zone. Associated with serious lung and heart damage, definitely not harmless.
Okay. Vaccination. A cornerstone of public health.
Unquestionably one of the greatest achievements. Dramatic declines in terrible diseases, essential for control and prevention.
So counseling patients on age-appropriate vaccines is standard practice.
Absolutely, for themselves and their children.
What about vaccine hesitancy?
Requires careful handling. Listen to concerns, explain the benefits, individual, family, community, and review the very low risks.
The bottom line is, current vaccines prevent diseases far worse than their rare side effects.
Absolutely. Knowing the actual rates of side effects and the high efficacy helps guide informed choices.
Mental health and addiction also key areas for prevention and well-being. Assessing for depression and cognitive issues when concerns arise.
Critical. These significantly impact quality of life. Depression screening tools exist. Cognitive decline can happen with age or illness.
Tools like the GP Go or Minicog can help with a quick cognitive assessment.
Yes, they're useful rapid screening tools.
Alcohol abuse, common but underdiagnosed.
Very. Simple screening tools like CAGE can help identify potential problems quickly. Cut down, annoyed, guilty, eye-opener.
And the opioid epidemic remains a major public health crisis.
A huge challenge. Screening tools for opioid dependence are also available and important.
What about basic safety? Still important to ask about seatbelts, domestic violence, gun safety.
Ongoing importance. Simple questions can make a difference. And assessing suicide risk in patients with depression or past attempts remains critical.
So, pulling it all together, the overall approach to the patient in prevention relies heavily on
Basic history-taking skills remain paramount. You have to understand the person.
because effective prevention requires patient engagement and buy-in.
Absolutely. They need to be partners in the process. Skills like motivational interviewing, eliciting commitments, contracting, they add significant value here.
And all the new tech wearables, apps.
Rapidly expanding, yes. But how best to use them, their real impact? Lots of research still needed. Uncertain future implications right now.
And exploring behavioral economics to understand decision-making and incentives.
An interesting area, trying to figure out what really motivates lifestyle changes and treatment adherence.
So the final point in this section, prioritize. Limited time and wellness visits means focusing on high-impact factors affecting longevity and quality of life.
Exactly. Focus on evidence-based prevention and counseling, maybe less on the low-yield comprehensive exam and asymptomatic folks. Setting expectations and planning follow-ups is key for better outcomes.
Okay, that covers a lot of ground on prevention strategies.
Yeah.
Part 3 briefly touches on vaccine opposition and hesitancy.
Right. Just reiterating that vaccines are a massive public health success story. Huge declines in disease, morbidity, and mortality.
They've been crucial for eliminating, controlling, preventing infectious diseases.
Undeniably. But this success story is now facing challenges from growing vaccine opposition and hesitancy.
It's a complex issue that needs careful navigation.
Definitely requires understanding and thoughtful engagement.
Okay, let's try to synthesize the key takeaways from this whole deep dive. We really explored the physician's role, teacher, learner,
The different levels of prevention, from tertiary rescue to primordial foundations.
and the absolutely critical importance of lifestyle. Diet, exercise, sleep, weight, not smoking.
And empowering individuals with evidence to make informed decisions about vaccines, screenings, and their overall health journey.
All tying back to that goal. Compression of morbidity. More healthy years.
Maximizing health span, minimizing the time spent unwell.
For you listening, aiming to master this like the pros, understanding these principles gives you a powerful framework.
It equips you to navigate health choices, to advocate for yourself, to really pursue a healthier life proactively.
It gives you that insider perspective.
Exactly.
So here's a final thought to mull over. Given all this evidence, how can we individually and as a society truly prioritize that upstream primordial prevention and health promotion?
How do we really shift the focus to building health from the ground up to truly square that curve for everyone?
Something to think about. What are the long-term implications of taking a truly proactive stance on health?